After the history and the clinical examination is when you go for workup or investigations. Of course, not all cases would need an investigation, so you would have to rationalize your approach depending on what you think is the main differential diagnosis. So we call it a differential diagnosis because no single pattern will fit a specific diagnosis all the time. Of course, there are certain conditions, like if you have a child with Down syndrome, that will be a quick spotter like diagnosis, and there are specific conditions you can diagnose quickly, but most of the times you form a differential diagnosis and then you narrow it down depending on your assessment findings. The investigations would depend on your top differential diagnosis. So you need to have one or two differential diagnoses which you would like to rule out first, and then you plan the lab tests and procedures or imaging as it may be appropriate. In terms of lab tests, we have different labs which are involved. So hematology would be including blood count, peripheral smear, blood group, and if you have specific cytology related to blood disorders like leukemia, you do a bone marrow aspiration biopsy. So hematology basically leads with blood-related, blood parameters related investigation. Biochemistry, as the name suggests, deals with the lab where the chemistry is measured. So you have the serum electrolytes, which include sodium, potassium, calcium, magnesium, your serum protein levels, the liver function test, or kidney function like creatinine, urea. Blood glucose is of course included. If you have any endocrine condition, you may measure the thyroid hormone or insulin level or cortisol as appropriate. You have testing conditions for some of these, like if you do lipid profile, you need to be fasting for that. So all these instructions, and the lab will have specifications on how much sample they need in what container. So you need to take it related to that. Microbiology relates to organisms which produce infection. So it starts with gram staining, where the fluid you are checking is smeared with gram stain, and then you assess under the microscope whether the bacteria is gram positive or gram negative. Gram staining also applies to any growth on the cultures. So culture is just a way to allow the bacteria to multiply so you can identify. So you culture the blood or any body fluid in specific culture medium. You have specific medium for aerobic bacteria, and you have specific medium for anaerobic, which are more difficult to grow. Then fungal stains are available as well to look for fungal hyphae, and you can also culture the fungus. The PCR based testing is very important as well, and genetic studies would include karyotyping, specific panels for suspected testing, broad testing like microarray, exome sequencing, whole genome sequencing. So all these are very recent developments. You are expected to know a little bit about whole genome sequencing, for example, which is a very important recent development, and it might change the way we approach diagnosis.